President, we're rapidly approaching perhaps one of the most important votes for all of us here in the United States Senate. This is bigger than any of us, our parties, or our ideologies. This about the very future of the greatest nation in the history of the world. It's about your children, my children. It's about your grandchildren, my grandchildren. Elaine and I even have 3 great-grandchildren and 2 more on the way. I'm concerned about them. It's about giving our future generations the same opportunities and same sense of pride about being. It is about every American way of life and every American business that was subject to this look at that thing, 2,074 pages edict from Washington. Now, I'm going to spend my time before this historic vote to highlight some very important numbers so every member of this chamber understands what they are voting to advance. Make no mistake, our actions today will not be without consequences. History and our future generations are going to judge us by what we do here today. 0, the number of provisions prohibiting the rationing of health care. 0. Not one word prohibiting the rationing of health care. All you got to do is look at some of the things that just happened this week, and you start to worry about it. How about this? 0, the number of government-run entitlement programs that are financially sound over the long term. 10.2%, our national unemployment rate, the highest in 26 years. 70, total number of government programs authorized by this bill. 70 new programs at a time that we're going into fiscal insolvency. 1,697 times the Secretary of Health and Human Services is given authority to determine or define provisions in this bill. 1,697 times that the Secretary of Health and Human Services is given authority to determine or define provisions in this bill. We're turning the whole thing over to the bureaucrats here in Washington. 2,074 total pages of this bill. Look at that. 2010, the year Americans start paying higher taxes to support this bill. Yes, we begin in 2010. My colleague from Utah, my colleague from Arizona, the colleague from Tennessee have brought that out, I think, in no uncertain terms. 2014, that's the year when this bill actually starts. Most of the major provisions of this bill. And some of them don't even begin until 2015. 6.8 million, that's the cost to taxpayers per word in this bill. Per word in this bill. $8 billion, the total amount of new taxes on Americans who do not buy Washington-defined health care. $465 billion in cuts in Medicare at a time when Medicare faces a $38 trillion unfunded liability to finance more government spending. $494 billion, that's the total amount of new taxes in this bill. And if you think that's all, I think you got something coming here. $2.5 trillion, according to the Congressional Budget Office, according to the Senate Budget Committee, that's what, using the Congressional Budget Office figures, that's the cost of this bill over a real 10-year period. $12 trillion, that's our total national debt. These numbers are facts and they're indisputable. And let me finish by reading an excerpt from a letter from one of my fellow Utahns from Provo, who is worried just like me about what this bill will do to our country. Quote, I am writing out of deep concern over the increasing expansion of government. I moved here from Germany 20 years ago. I love America because it is free, freer than Germany in that I have the freedom to choose, among other things, how I want to insure my family. In parentheses, we have 6 children, close friends. I'm all for affordable health insurance, which requires affordable health care. I am self-employed and have been hit hard by the economy. There's a good chance that we would actually benefit from this bill. Business has been so bad that we would qualify for free school lunches if we asked for it. But I don't want any more government handouts. I don't want the government telling me what kind of insurance I need to have. I don't want the government telling me what services I can receive when I need them. I don't want them taking an ever greater part of my income to help finance government programs such as the, quote, public option, unquote, and the army of government employees it will take to administer such a program. I do not want more government. I want less, a lot less, unquote. Those are people who have been living in our country as citizens for 20 years, from Germany, and they know what it was like to have that type of a system. I think we ought to pay attention to that humble person who, in spite of the travails that they have and the difficulties they have, they don't want this big, massive government program to become law.